In my world there is music and good vibes and laughter and lovers, adventure and friendship. We know who we are.
Welcome to Be the Wellness Podcast, where we help you master your body, mind, and the experience of life through insightful conversation, interviews with experts and thought leaders, all with a side of marital banter and some good old-fashioned humor.
Yes, we are your hosts, Adam and Vanessa Lambert, and we're committed to helping you live life fully expressed physically, mentally, and experientially. Sit back, grab a cup of coffee, and join the conversation.
Welcome back to the show, folks. Adam and Vanessa Lambert here with a fantastic podcast.
Yes. You know, I love diving into the world of how, I guess this wouldn't really be a psychedelic, but it's kind of in that same vein. But I love diving into the world of things that help people with mental illness, with depression, with anxiety, with all of these things that we are just being faced with so profoundly these days in the coronavirus age, and really just in general. I mean, we've just seen such a trend towards people having a lot more anxiety than ever.
Yeah, for sure. And like so much so that there's starting to be like other diagnoses, right? So it's like there's depression, and then there's treatment resistant depression, and then there's drug resistant depression, right? And the same goes with PTSD, the same goes with all this stuff, right? So it's like the more that we kind of dive into these ailments, and the conditions and just sort of the general way of being that's starting to show up, we're starting to find more and more layers where, the kind of normal procedures and certainly the normal pharmaceuticals aren't really getting the job done,
Well, and I think what I was listening to a podcast with Tim Ferriss, and one of the women who's working pretty intensely with the MAPS organization. And one of the things that stood out to me in their conversation was, I think he made the point that, there hasn't been any really breakthrough developments in the area of psychology or psychiatry,
right,
or dealing with sort of mental disorder and dysregulation in like 50 years,
right?
We really haven't seen, aside from antidepressants,
right,
and that kind of genre is the only thing that we've really seen developed in the last, half a century. There hasn't really been anything profoundly new and inventive in this area of medicine. And so we're finally seeing some breakthrough modalities that are having a tremendous effect on PTSD and anxiety and depression and some of these things that really we haven't seen the ball move forward on in almost half a century.
Yeah, that's interesting. It's kind of like there was Freud, and then there was pharmaceuticals, and now here we are.
Yeah, exactly. And, and arguably, like, obviously, everyone can have an opinion on antidepressants and the efficacy of those and how well those work for long-term treatment. But I would say that generally speaking, the jury feels like it hasn't really delivered in a very, in a way that truly solves the issue.
Right. Totally.
For as generally speaking, obviously there's people who've used it and had great success, and maybe it got them through a rough patch, and there's all of that stuff. But generally speaking, we can't really point to something and say, you know what? You've got anxiety. Here you go. This is the thing. Right. And we're starting to see that emerge. And today's guest, Dr. Matthew Cook, is really spearheading a certain genre of that, if you will, with ketamine therapy.
Mm-hmm.
And, it's kind of cool because ketamine is actually legal, whereas MAPS is having to sort of undo some of the regulations around MDMA and mushrooms and some of these things that were classified as Schedule I drugs, back in the 70s.
Mm-hmm.
MAPS is having to undo some of this. So the cool thing about ketamine is that it's actually legal and they're able to start working with it. And that's what Dr. Cook, who is a board certified anesthesiologist, he actually developed a clinic called BioReset Medical in Silicon Valley. And he's using his extensive experience using cutting edge treatment protocols that support and modulate the immune system and help one's body to prevent and combat viral illness, but he's also working with ketamine therapy for treatment-resistant PTSD, for anxiety, depression, and sort of the whole gamut of those, mental and emotional disorders.
Yeah. Yeah. He's got quite a thing going down there, and as you guys will hear in the podcast, he's a wealth of knowledge and experience, which I think is probably the most important aspect of that, in this field. And what I kind of got from him is that they're just open to whatever it takes to solve the problems.
Exactly. Yes.
And he's, as you guys will hear, he's not really afraid to kind of buck the trends, as one way of looking at it. And especially in the face of, we get into it kind of right at the end of the podcast, in the face of all of the, it's like the downplay and in some cases outright censorship of alternative methods for treating COVID specifically. And it kind of goes out to everything else, but like COVID's top of mind right now.
Right.
And so I think it's cool, when you have people who are really, truly dedicated to figuring this stuff out and aren't afraid to kind of swim upstream a little bit, you've really got a chance to make a difference,
Yeah. And what I really gather from him is that he's actually just thinking critically about the issues that are at hand, he's not just taking the bylines and the standard protocols. He's thinking critically about his experience. He's looking at the treatment methodologies that he has access to and how they can be used to really assist people in a variety of things. And so he's running the gamut from biohacking to, just like more standard protocols and treatment protocols. And it's just really cool because at the end, what I feel like is I can appreciate and I also can distinguish when people are just looking at the issues at hand and they're really trying to come up with solutions rather than go down the rabbit hole of dogma and sort of, whether things are on label, off label and getting into that sort of, that whole argument that exists around all of that stuff.
Yeah. Yeah. He's cool.
Yeah. He's cool.
He's fun to talk to. And I think probably a pretty awesome dude, if you get a chance to hang out with him. So, we should just dive into it.
Let's do it.
And we're live. Welcome to the podcast, Matt.
Oh, thanks so much. I'm delighted to be here. Thanks a lot.
Yeah, we're really excited to dive into so many topics with you because when we, got your bio and sort of your portfolio, if you will, there was just a ton of talking points on there that we were interested in going to with you. So we want to jump right in and kind of get started. And maybe you can just give folks a little bit about your background, particularly when it comes to the treatment of PTSD and how you sort of got it moving in that direction. Because that's something we really want to touch on. And maybe we can kick off with that as the first sort of talking point.
Okay, cool. Yeah. It's actually pretty interesting. I'm an anesthesiologist by training. And I think probably a lot of anesthesiologists end up with PTSD as kind of a side effect of the profession. But I was working in a hospital and doing trauma surgery. And then I started working in surgery centers. And I became kind of an expert at what's called regional anesthesia, where I would use an ultrasound and I would put local anesthetic or numbing medicine around nerves. And basically put either your arms or your legs or some part of the body to sleep and then do surgery. And when I did that, people wouldn't have any pain when they woke up because the area where the surgery was totally numb. And then I ended up finding out that a lot of times if I used other things like stem cells or other solutions that had growth factors or anti-inflammatory components, a lot of times I could do the same technique, putting fluid around nerves, and fix nerve pain. And so then I developed a practice that was kind of around that, but interestingly, I'd been studying integrative medicine for about 15 years. And so I put together a practice that was part integrative medicine, part regenerative, but an area that had been near and dear to me through that whole experience was PTSD and trauma. And it turns out that there's a technique that comes from anesthesia called distilling ganglion block, which is something that can be helpful for that. And turns out there's another thing that can be super helpful called ketamine, which comes from anesthesia. So even though anesthesiologists get a lot of PTSD, I think we actually have a whole bunch of tools in our backyard that are kind of helpful for it. And because of that, I just started seeing a lot of people with that condition. And so it became kind of a passion play for me. And it might be just about my favorite thing that I do. So
yeah, I could see. So, okay, I just want to clarify. So you're saying that anesthesiologists have they experience a lot of PTSD, like within the trade?
Well, I think so. And what the interesting thing about that is in anesthesia, you walk up and meet somebody, and then you have to figure out their entire medical history in like 4 or 5 minutes, usually. And then you take them back, and then you put them all the way to sleep, and you put a breathing tube in, and then you take over 100% control of their physiology. So you have to make sure their blood pressure is okay, their heart rate is okay, their oxygen levels are okay. And then you have to let surgeons do crazy things. And sometimes people will lose a liter of blood a minute. Sometimes their heart can go into electrical abnormalities. And so the common term about anesthesia is hours of boredom punctuated by moments of terror.
Yeah,
and
totally.
So then those moments of terror is like how you kind of choose to manage it. And so then it's an extremely high stress profession. But the story that I'm telling anyways these days is that it oriented me to a problem, and it actually taught me all of these skills that are now the skills that I use to help people. So I'm actually totally grateful that I ended up getting to go into it, because if I hadn't gone into anesthesia, I don't think I would have any skills to help people. So I'm kind of delighted about it.
Yeah. I mean, sometimes, for sure. It's like, it really does take, a full understanding of what it is that folks are going through. And I think, I think PTSD is probably this way in a lot of aspects of life, but PTSD is such a magnifying glass for that sort of feeling that you have of like, if you've never had this, then you can't understand what it is that I'm feeling, because this is a really weird thing, right? Your body's going through once you've experienced some spike in trauma in one event, or this kind of accumulative effect that we see kind of in the first responder and military realm. So it totally makes sense, right? That you'd be like, hey, here's a niche that I can fill, and something that it just becomes super important once you've experienced what it's like to sort of see some of the negative aspects of this. So I think it's pretty awesome that you're getting this opportunity and looking at it as exactly that, like an opportunity to, really give something back in an area that you have kind of a unique experience of.
Right. And so then I'll kind of tell you about this. Is quite interesting. We have a part of our physiology that is paying attention, like just for the three of us here right now and everybody that's listening, we're all sitting here, and every second, every millisecond, our brain is making a split-second decision. Is everything cool, and is everything just totally fine, or is this a fight or flight situation? Now, normally, let's say this is a podcast, it's kind of a nice, it's perfect day, so it seems like everything maybe is totally fine. Okay? And so then if everything's totally fine and we're just sitting here having a great talk about life and the nature of reality, then what happens is the brain says, oh, okay, everything's cool, so we're going to run rest and relax. And so when you're running the rest and relax program, then that says, oh, okay, everything's fine, so let's spend some of our energy on digestion. Let's relax. Let's feel good. All the blood vessels are relaxed because we're not really doing too much. And that is a super healthy state to be in. And then if we're in rest and relax, then we're probably going to be telling great stories and having a good time. So that means we need our whole brain to be on and working. And so then we turn our whole brain on, and we turn our memory part of the brain on so we can remember those good stories and stuff like that. Now then, if something sketchy happened, the building got on fire or something crazy happened, then our brain would go, uh-oh, there's fight or flight. And so then when you go into fight or flight, then all of a sudden we turn off memory because it's not so important, because we're just going to move on instinct. And then we vasoconstrict our blood vessels. We turn off digestion, because the idea is we need to get our blood pressure up, and then we need to be able to get out of here.
Right.
Now, one way of thinking about PTSD is that it's that the body gets kind of stuck in a fight or flight situation. So then you can imagine if you went to war and every couple of days there was a big crazy thing that happened that put you in fight or flight, at some point you might just say, I think I'll stay in fight or flight all the time.
Right.
Or victims of sexual assault or trauma, or let's say, with everything going on now, racism. And so then you have all of these triggers that could be a trigger that someone faces every single day for years and years and years and years. And so then that can leave the nervous system stuck in a fight or flight state. And I like to think of, there's probably a lot of people that meet criteria for PTSD, but there's probably a whole bunch more people that are on the PTSD spectrum. They're probably way more in fight or flight than would be optimal, but they might not meet criteria to be totally in what's called PTSD. And so then our philosophy is to try to reset that. And part of that is just by telling a great story. Some part of that is ketamine is this anesthesia drug that can reset the fight or flight nervous system. And then we do these injections. But what I found is that, and there's a lot of interesting work in psychedelics kind of looking at this, but what I found is that a multimodal approach where I put together a whole bunch of different modalities that are working by different mechanisms to help reset that physiology, to help drive us back into a rest and relaxed state. And so then you begin to realize meditation, mindfulness, yoga, everything that is good and that is generally culturally and socially known to be good tends to drive us into that rest and relaxed state. And so now we're basically trying to hack our central nervous system physiology so that we can get into a state of wellness and then try to maintain that state of wellness.
Wow. So you said there's a lot there. And so I kind of want to unpack a little bit of this because I think there's some incredibly important aspects to this. So I'm just going to kind of see if I can package up what you're just saying. So there's this concept that a persistent state of stress, like of an amplitude high enough to kind of get into this fight or flight scenario, it develops a pattern, right? So and then the next time that little thing triggers, we can kind of go right back into that specific phase. And then if we're there long enough, then just as a matter of, conservation of energy or something like that, right? Our body's like, okay, you've lost your hall pass, right? We're just going to stay here in this elevated state.
Awesome.
And so what I'm wondering is, how is it a matter of like repatterning that state? So where you're using, the tools that you were just discussing to kind of break the cycle and then repattern the response, or how do you see that aspect of it?
Yeah, that's so awesome that you said that. That's exactly, a lot of times I'll tell people it's almost like we're trying to defrag the hard drive. So we're trying to reset what those triggers are. And then we're trying to repattern that like everything is okay. And now it's kind of tricky because as I mentioned, a few of those triggers, it's tricky because often those triggers are not going to go away.
Right.
And so then how do we repattern and retell kind of a new story about who we are, how we are, and what our role in the universe and in our society and culture is? And so for each person, it's a little bit different. But what I've found is that as it's kind of crazy, but as soon as I start talking like we have this possibility to repattern it, then people are like, oh, awesome. And so then, like, when I first started doing this 4 or 5 years ago, people would come in and I would kind of tell them that you could repattern things and we're going to retell a new story and blah, blah, blah. And people would look at me like I was a little crazy. And now what happens is people generally come in and they'll say, oh, I listened to all the podcasts and I totally understood. And then, what he said about repatterning, I really liked that. And I started to do it and I'm already like 30% better. And I know I'm going to get better. And interestingly, as soon as people kind of come in that state, I generally feel like any one of 5 or 6 modalities would be pretty darn helpful. And have you ever heard of the 99 monkeys?
No,
I don't think so.
It's so amazing. Like they take like a monkey and they're living in a lab and they teach them a task and it takes like 10 hours to teach them the task, right? And then they put another monkey in there and another one. There's 10 monkeys in there, but it still takes like 10 hours for each new monkey to learn the task. Once you've got like 100 monkeys in there, then all of a sudden a new monkey comes in and he learns the task like right away.
Oh, wow.
He just sees all the other monkeys.
Yeah.
And so then my philosophy and I'm telling you, it's kind of bearing out in my practice, is that I think people are beginning to realize, we can, you said it perfectly. We can repattern and start to tell a new story and reset our physiology. And what I believe is that people are going to become aware that is fully possible.
Right.
And it was kind of like when I was in medical school, they told me, don't do PTSD because nobody gets better. Like they would say that when we walked around the VA, it was crazy. And so, but I'm saying, everybody's going to get better.
Well, I think there's a real paradigm shift around this. And, Adam comes from a background in the fire service. He left his job, didn't officially retired, but left his job early because of our company and, going full time with us in a couple of years ago. And, we've talked at length about his experience with PTSD and we've done ayahuasca and we've done some plant medicines and he's had tremendous results. And so I'm really excited about this idea of ketamine because obviously ayahuasca is a bigger pill to swallow, if you will. And, not everyone's necessarily ready to go there, or maybe it's not the appropriate treatment for them. There's lots of reasons why, that's a great cog in the wheel, but maybe it's not the right cog for you. So I really want to dive into this ketamine story because I think that this is something that obviously is legal in the US. You are administering it. You have a protocol around it. So maybe you can just talk a little bit about what that looks like for people, what, the process of discovering if you're a good candidate for it, the actual treatment itself, and some of the results that you're seeing.
Oh, so that's great. That's a super interesting question. Ketamine now this goes into dose. So in high dose, ketamine is an anesthesia drug that's a dissociative anesthetic that makes you not feel anything and makes people not have pain during anesthesia. So I used to give it a lot to kids and I used to use it all the time as part of anesthesia because people would have less pain after surgery. But it turns out you can give it in low dosage. And when you give it in low dosage, it turns out it works real well. It's actually a mild psychedelic, and then it's mildly dissociative. There's a bunch of different ways that you can give it. So you can give it as a oral lozenge. And so during COVID, we had some people who were at home, and we're still doing that, who are pretty traumatized and afraid to go outside and stuff like that. And so we will do a video call with them, and they will take it as a lozenge. It goes into the back of their mouth, and they suck on it almost like sucking on a lollipop, and then it can take its effect. We do injections of it, like a little IM injection in the clinic, but the thing we have the most experience with is doing IV infusions, and when we do it, I almost always do an infusion of a vitamin called NAD before, and I found that NAD makes ketamine work like 50% better, and it also makes it last a lot longer. Usually ketamine will have a effect of turning the depression pathway off for a couple of weeks, and then it will people will do a series of 6 treatments, but sometimes I'll get months and months of benefit just from one treatment when I combine it with NAD.
Oh, wow.
Interesting.
And what's the mechanism for that? What do you think is making that difference?
I think that NAD, when you put it intravenously, or if you do a subcutaneous injection, and I teach a lot of doctors how to do this, but when you do NAD helps to reset your mitochondria and turn physiologically help to turn the brain back on. So a lot of times when people do it, their brain fog will go away and they'll feel better. And NAD helps to drive oxidative phosphorylation, which is basically, it helps your cells in your brain burn energy more efficiently, and it helps your mitochondria work a little bit better. And so then my theory is that if I can take all the cells in your brain and get them working a little bit better than average right before I do the ketamine, then the ketamine is going to work better. And so this is just a theory that I came up with, but it's definitely borne out.
Yeah, it's almost like making your brain more bioavailable to it or something.
Yeah, that's a nice way to say it. And so then what the idea is that we're kind of cultivating and curating a story that centers around you're going to heal and you're going to overcome whatever the trauma was, and in some way the journey of going through that is going to you're going to realize that you're more resilient, you're wiser, you may have more to give back. And so we try to find a little silver lining within everything that's happened. And so that's like in big terms. And so each person, it's a little bit different. And so part of it is talking. And so sometimes what we'll do with the ketamine is we'll do very low dose. And so for doctors who are listening, I've had women who were in their 70s and 80s who didn't drink and were very sensitive. And I gave them 5 or 10 milligrams of ketamine, and they told me it was the best experience of their life. But 5 or 10 milligrams of ketamine is a very low dose. Normally, for someone who might weigh 70 kilos or like 165 pounds, normally what we would do is we would give 30 milligrams. So like 6 times that much. And so the normal dose is 0.5 milligram per kilogram. And so and the other thing that I've been doing a lot of is I will sit and we'll talk to people and actually do like therapeutic conversations while they're on ketamine, which is kind of similar probably to what a lot of people are doing with plant-based medicines. And it's what I found is because ketamine is mildly dissociative, what I notice is that it kind of separates people a little bit from the trauma and gets them to a point where they can talk about it. And then in the process of talking through it, then all of a sudden we can begin to kind of defrag some of those triggers and often reset the triggers.
Yeah, absolutely. So I want to kind of drill down into what the actual biological effects are. So is it working on the serotonin system, or is it actually just that it's helping the body to get out of the sympathetic drive? Like, what is the thing that is actually kind of repatterning, as you said?
So then ketamine is one reason why it may be so helpful is that it works broadly across the central nervous system. So
Okay.
It turns off, the most famous thing that's known for is it turns off this pathway called NMDA. So it's an NMDA antagonist, which may be associated with depression. And so that may be why when you give people ketamine and you're beginning to turn the depression pathways off, there's some trials that have shown that ketamine has some benefit for people with drug-resistant depression, which is a pretty difficult topic to deal with. But then it also is broadly stimulating across a number of neurotransmitters. And so but then it's also dissociative, and it facilitates unwinding emotional triggers. And then it's also mildly psychedelic, and a lot of times people will see, oh, I actually have some hope, or I feel good for the first time, and then, or I'm, another one is I feel safe for the first time.
Yeah.
And so then which one of those is the one? I don't know. But what I'm trying to do is use all of them to then help curate and tell a story that is a story. And the moral of the story is always, it's going to be amazing. We're going to overcome whatever the trauma was. The trauma is going to make us a somehow more empathic, kinder, gentler person. And then we're going to ultimately get to be who we were meant to be on this planet, and then evolve and grow from there.
Yeah. So something that you said kind of in what you were just talking about is that I kind of want to hover on and make sure that I grasped that, and that it was something about when you're saying that when you're repatterning and kind of creating this new story. I think you said something about what you have to contribute, and like meaning the person who's undergoing the therapy, pointing out that they have something to contribute to this world. Is that, did you say that, or did I make that up?
I think so. Yeah. I mean, I love that. I think that's a super amazing concept.
So this is it just dives right squarely into my experience kind of with PTSD, and some amount of what I've read about other people's experiences, and they, one of the feelings. So like for me, specifically, I mean, given the various, acute, just completely gnarly situations that I found myself in over the course of, 22 years in the fire service, the sort of long-term component of that, the piece that really tails on at the end, which honestly is stuff that I'm kind of only starting to feel given the slowdown in just general life that we've had due to lockdowns and COVID and all that, is the sense of loss of purpose now that I don't do that job anymore. Right. And it's something that gets really deeply ingrained, is like here's this thing, and I'm doing this thing, and that's what I'm here for, and that job is very, very good at providing that sort of sense. And something that just when you were talking about that, like I've read about this. I think they call it Platoon Syndrome or something like that, with the guys who are coming back from overseas, who outside of this group of peers who have experienced similar things to them, they feel very alone, and they feel like there's no one can relate to them, and there's no like ability to like, what am I doing here? Without these guys, what am I doing here? And so it's really interesting what you're saying about in that space, somehow being able to provide them with an opportunity to see the value and the contribution that they are bringing just as like a person, I don't know where I was going with that, but it's what came to mind.
Okay. So I'll go with you on this one. I love that you said that. So, this is this idea. Erickson and Piaget were these like European kind of philosopher, physician characters, and And so there was these idea of all of these stages of life that you go through. But then the final one is generativity, where you give back to society and culture, or you make some kind of sense of what's happened to you, and then contribute and give back. And in a way, the human condition is typically one of difficulty, and then we die. Okay.
Mm-hmm.
And obviously there's love and good things that happen, but the human condition is frail and fraught with difficulty. And so then the most important thing is to make something of what happened to you and contribute and give back and contribute. And so now what happens is I remember when I went to medical school, you're like 100% that you're going to do it. Like you're going to be a doctor, you're going to go out, you're going to change the world, you're going to do good things. And then next thing you know, you're working 80 hours a week and you can barely keep up. And then you begin to start to have this existential fear that I may not be able to achieve and contribute and actually do anything profoundly meaningful with my life. Mm-hmm. And that's, I felt that moment. Like I felt like, I may be doing anesthesia and I may never actually contribute and do anything. And yet you're profoundly helping people and guiding people through difficult things. Our background is almost the same, because being an anesthesiologist is like being a first responder.
Right.
But then what I have found is that every single person that I've ever met with PTSD and trauma is almost all the same. It's all similar themes and concepts and stories. Right. And then at first, when I would hear those stories, it was a little bit overwhelming because they were somewhat reminiscent of maybe my own story. But now when I hear those stories, I just get like empathetic in this incredible, like kind of soft and like almost like I'll almost be kind of happy, because I'll be like, oh, we're going to totally help you. Like you're going to overcome this. And so then to me, that's the antidote to the Platoon Syndrome, because it turns out if you could have been in a platoon, right? But you might actually be able to help a victim of sexual assault, which is like almost like the opposite, but it's still similar to like, because you both have PTSD from not feeling safe. And so then what happens is in reality, we're all the same and we're all looking for the same thing. And so then we just have to figure out how we can do something to contribute. And actually, you're totally doing exactly the right thing, because you're talking to people and spreading good information. So it's actually, you're doing perfect.
You're on track.
You're right on track.
No, it's really amazing. And I would just, I'd be curious to hear your thoughts, because something that has occurred to me is that I actually think most people do experience PTSD at some point in their life, and that, these therapies or therapies like plant medicine or what have you are almost applicable for most people. Like most of us have stored trauma that if we were able to release, if we were able to repattern, as you say, we don't necessarily have to be suicidal before, we can optimize some of these patterns. And so I'm curious, like what you tell people, what kind of person you tell, who's good for this sort of treatment, or who you would say, okay, hey, if you're experiencing any of this, this could be beneficial.
Yeah, that's a really good one. And so then I would say that I would like 100% agree with everything you just said. And so then in terms of processing through that, then you begin to say, well, there's all roads lead to healing. And so then you've got, obviously you mentioned the plant-based medicine, which I think is interesting. Ayahuasca is, people get so nauseated and is kind of a little bit uncontrolled and hard to manage. Ketamine, we can start really low. It's safe. It's legal. And so I think it's a nice place for people to start. We do the stellate ganglion block. But then remember my 99 monkeys. I'm telling you that I think that as consciousness around this grows, and as people begin to realize, oh, I can kind of take control of that, and I can reset that, and I can begin to reset those triggers. What I think is that there's going to be an evolving story that people tell, which is, yeah, I have a little PTSD around this or that, but I'm beginning to heal it. And then the second that starts, it's like a fractal that kind of just continues to create more and more healing in a more robust way.
Yeah,
I love it.
The 99 monkeys thing is super fascinating, and I think so. To kind of give some legs to that from my perspective, like I think a huge piece of this is literally just people sharing very authentically what their experience with all of this stuff has been, and I know in the fire service it's still a little bit taboo, and I was fortunate to work for a department that was very progressive in they called it critical incident stress management, but like the debriefing processes. And there was a very clear protocol for kind of how to unwind people after these acute situations. But it really starts with a group of peers who you have some respect for and can, as opposed to sitting down with like a mental health professional, you're like, what do you know about this? You know what I mean? Which obviously they probably know a lot, but not from an experience perspective, right? So sitting down with that group of peers and then just sharing the story, and that opens up this idea. And then, the facilitator who's been through this a number of times says, hey, well, this was my story and here's where I am now. And guess what? There's nothing wrong with you. You're having a perfectly normal reaction to an abnormal situation, right? And so it starts this kind of unfolding of the story that I'm broken, or the story that this is how I'm going to be forever. And the fear that I think comes from that, which probably just kind of doubles down the overall problem, right? So if we can get the message out, right? If we can put more monkeys in the cage, so to speak, right? We're just getting people in here and saying, hey, look, here's what's going on. Here's what's available to you. Like the speed at which this whole thing, people can fundamentally heal themselves and recognize maybe where their patterns of trauma are, and then feel comfortable and maybe even excited about, the future. That's cool. I think that's a fantastic analogy for this whole thing.
Thank you so much. It's crazy because you were probably like me. Like there was one thing that was known pervasively everywhere I've ever worked my whole life, which is that you should do anything to avoid at all costs ever having to talk to the physician well-being committee.
Yes, exactly.
And so then what happens is there was a thing. It's like, how are you? And the answer is like, perfect. How are you? It's just
fine.
Like, the never ever admit anything because they were basically trying to hang you. Was kind of the mentality, but then that leads to isolation, and then from isolation leads to no talking and sharing. And so and group therapy is profoundly amazing. That's why that's why all of these good organizations have been so helpful to people. And I've been very actively trying to build a bridge and talk about this. And I feel truly hopeful, and I'm so grateful to kind of get to talk to you guys, people like you. And the first responder is so analogous to what I did in anesthesia that I have a good feeling for you.
Yeah.
Yeah. So I want to just walk into the fine print a little bit here so that folks out there that are listening can understand, if they might be a good candidate for this. Can this work at the same time as other therapies? So for instance, can you be on antidepressants? Can you be on any other medications? Do you have to be off of your meds for this? What's some of the details around who can actually start this therapy?
Oh, that's a good one. Yeah. So definitely you can stay on your antidepressants and stuff like that. Um, so interestingly, sometimes it's really hard for people to come off antidepressants. And sometimes if you take NAD, it can help people get off. And sometimes you can do an NAD IV, sometimes you can do NAD subcutaneous injections. And then there's a whole bunch of supplements. Quicksilver makes one called NAD Gold that I really like. And so there's and so it's very, very safe. Ketamine is super, super safe when it's administered in a safe kind of way. And and then the same is true for many of the other therapies that we do as well.
Awesome. I love that because I think that that's such a difficult one for folks to have to be off their meds before they can start any of these therapies. So it's amazing to hear that they can work together. And there's so many other things that you have expertise in that we would love to walk into, but we're almost out of time today. So I don't want to even, get too far straight off of this path, but maybe just quickly you can talk about some of the things that you work with people on in conjunction to the ketamine, because I know that you look at the gut biome. There's sort of, like you said, you really look at the whole spectrum of healing.
Oh yeah, we sure do. We take care of a lot of people with low-level chronic infections, and interesting. And one of them being mold, one of them being Lyme. We take care of a lot of people with Lyme disease, and so then it's been very interesting with that caveat to think about what to do regarding the whole COVID situation that's affecting everyone right now, and. What we do is we take a very multimodal approach. And so we do a lot of a functional medicine approach where we talk to people and address the body by organ system. So we look at the nervous system, we look at the gastrointestinal system, we do testing and try to figure out if people have parasites or bacterial infections in the intestines, which can dysregulate the immune system. And so we have kind of a thoughtful approach to that. I have a novel thing that I use with a lot of patients called Peptide Therapy. And we teach a lot of doctors how to do peptide therapy, but there's one peptide, and I'll tell you about this one. It's because it bears just hearing about. It's called Thymusin Alpha One. And I'm using that for a lot of people with chronic infections. And it's kind of useful to hear about it and read about it a little bit, because I think it is going to have a very provocative role in the treatment of COVID in this upcoming year. And what a peptide is every gland in our body will secrete a little baby protein that does something. So, for example, your pancreas is sensing what your blood sugar is right now. And if your blood sugar goes too high, then what your pancreas will do is it'll secrete a peptide. The name of that peptide is insulin. And then that will lower your blood sugar. So there's little baby proteins floating around in your body that are secreted for some purpose. And so it turns out that your thymus gland will secrete a peptide called Thymusin Alpha One, and then that helps your killer cells fight infection, and it helps regulate your immune system. And so I'm actually treating a whole bunch of people remotely who have COVID, and one of the things we're using is Thymusin Alpha One, and the reason that I knew about it is I've been using it for quite a while with patients who had chronic viral things like Epstein-Barr, and also with people with Lyme and parasites and stuff like that. And I'd been having really good experiences with that. And so this is something that, just like insulin, you take it as a little subcutaneous injection. But I believe, and I'm just going on record, that we need more trials around this. But I believe that being on Thymusin Alpha 1 is going to be proven to be prophylactic for preventing COVID infection. I believe that that's I think a study, if it's completed in the next year, will prove that. And then I also believe that treating patients with Thymusin Alpha One is probably going to be in the top 3 COVID treatments.
Interesting.
And so then that's going to be super interesting. So we do that as part of our approach to broadly to infectious disease.
That is fascinating.
Yeah. Well, the peptides almost seem like a free lunch in so many ways, right? Because they're, like you said, they're these little fractions of proteins that are just flipping switches somewhere in the body, right? I mean, it's my very, very rudimentary understanding. And so many of these they're modeling things that your body is creating anyway, right? You're manufacturing a key that fits a lock that's already in your body, right?
Yeah, that's right. That's a good one. I like that you said that. I have this friend of mine who I've been treating with it who had COVID, and he goes, I feel like I'm cheating because he goes, it's going so easy with this.
So is it your opinion, though, that we should be trying to take preventative measures to avoid it? Or do you think, getting it is the best thing for all of us to sort of develop this herd immunity, but having these therapeutic treatments that are, stabilizing and assistive to getting you through it with ease? Like, what are your thoughts on which path is the best path to take?
So this is the answer to questions like that are always, it depends. And it depends on what's going on with you, with your physiology, with all of the other medical things that are going on, and to try to take a thoughtful approach. And then what you'd like to be able to have some evidence that's in peer-reviewed literature that you can look at that can help guide good decision-making. And then within that, taking into context how old you are, how immunocompromised you are, what risk factors do you have. And so obviously there's a lot to unpack there.
Right.
And so then within that, I think it's too early to say, should people take it prophylactically? And also there's not that many people that really even know about it yet. But what I can say is that I think that evidence is going to prove that it's helpful. And so that's a educated guess, but it's not a statement that people should go out and do that. My experience in treating people is that it's very helpful. And so we have people who we're talking to on telemedicine, and then we're prescribing it. And basically what we do is we call it into a compounding pharmacy. And so the cost is just the cost from the pharmacy, which is not too much. It's maybe $150 a month or something like that. And so I'm in some of the things that I'm really encouraged about it are low cost to the patient, and possible reward. It's going to be in the category of investigational, but an article just came out a few weeks ago that looks like it shows some improvement. And so I think it's going to be a super interesting area to watch. And then the entire field of peptide science is going to be is going to be probably one of the most interesting and exciting areas in medicine in the next 5 or 10 years to come.
Yeah, it's certainly the wave of the future, isn't it?
It sure seems that way.
So quickly, before we wrap up, I just want, since we're on this COVID topic, can you dive into, I think it's ozone therapy and how that relates to COVID as well?
Oh yeah, so ozone therapy is super interesting. The term is oxidative therapy. It's a therapy that comes from Europe and Russia. And unfortunately, it's not even regulated by the FDA. And but there are a lot of doctors in North America who practice ozone therapy. And there are machines called ozone generators that pass a 100% oxygen gas over an electrical discharge. And the electricity combines with the oxygen, and it creates some radical oxygen species, and one of them is O3. And then O3 degenerates back into O2, but it creates an electron that it can donate. And that electron can cause oxidation. And so there are some techniques where you can mix blood with this oxygen ozone gas mixture. And when you do, that blood can get oxidized a little bit. And so if there's any bacteria or any viruses in the blood, they can get oxidized. And the theory is that they get rendered ineffective. And so the ozone can oxidize the spike on the virus, or quote unquote the landing gear that it uses to attach the cell. And so the doctors that take care of Lyme disease and chronic viral infections have been using ozone therapy for years and years and years. And I think that ozone should be a very important component in treating COVID. Unfortunately, it's been a little challenging because from a regulatory side, people don't want people out there advertising saying that they can treat COVID, and so so right now we have an application in to do an IRB to try to start to enroll people in a scientific trial, and it's just been slow going getting approval for that, and so because of that, I'm not actively treating COVID people, but I would be willing to if I could get approval for that study. I think that ozone therapy is. I think that given everything under the sun, the two best things for COVID would be ozone therapy, intravenous ozone therapy, and Thymusin Alpha One.
Interesting.
But it's very off label, and I think probably somewhat controversial, and so and there's not a lot of great places where you can go get it, unfortunately.
Right. Yeah. It's such a tricky time for off-label and controversial things, and because it's like, I mean, we're just getting shut down, right? I mean, it's like things are being pulled off of social media and YouTube, and news reports are getting shut. Anything that doesn't sort of fit the standard narrative is having a hard time squeaking through. Yet this, if ever, there's a time that we just need this out of the box thinking of like, what are all the tools that we know that affect things that can work,
Right.
So I'm glad that you're sharing your perspective on it, and that we have a free platform essentially to do that, because I do think it's very important for people to to feel like there is other stuff going on, because it can start to feel hopeless when the only information you're getting is about, this drug, but that won't work, or this drug, but there's so many side effects, or wait for a vaccine.
Or vaccinations.
People can get a little disheartened. So I'm really glad that you're sharing that.
Yeah, and then what drives me totally crazy is that normally if there's a problem, then what happens is you go see your doctor and they process that and manage that. And so for every 100 hours you would have to go through 100 hours in clinic in general on average before you'd ever end up in the hospital, because they would do 50 different things in a clinical setting before you would ever go to a hospital. But because of kind of the fear of the infection, we've come to a moment where everybody's paralyzed, and so then everyone is at home sick. And so I've been talking to people that are like, I've been at home feeling like I'm going to die every day for the last week, and waiting to go in. And interestingly, now what I'm beginning to hear stories of is people who were in that state and got better and then got a relapse. And I've had a bunch of those. And so then you heard about, like, on the USS Roosevelt, there was a bunch of guys that were in a military quarantine and were cleared, and then went back to the boat and relapsed. And so what I will say is that I think that we need to think deeper about this, because I think that we may see people have relapses in the months and years to come from COVID. There may be a much longer tail to this. And so A, it's serious, but then B, I think that there's some very provocative things out there. And I think the ozone therapy and the peptides are 1 and 2, maybe peptides 1, ozone 2. And the reason I call peptides 1 is because it's something that you can do remote and at home. And I think that, as a physician, one thing that you can do if you're out on the front lines is you could be taking peptides. And I tell you, my friend who said he feels like he's cheating, him and his wife, they would tell me, they'd say, you know what, I can feel when it wears off, and then I need to do another shot. And so then for people who are sick, I'm guiding them through a cycle of injections throughout the day. And so, but I think that if we could treat healthcare frontline workers, we could start to test some of these modalities. And my plea is, if there is anyone that has the bandwidth to get a trial going, we're close. If anyone wants support in doing that, and especially what I feel like we need is a hospital setting, because a hospital could say yes and start doing this, and I think that you could really change the trajectory. But then I think really what you need clinics. And what I would like to do personally is have a separate clinic that was COVID only, and I would just go there myself and then just see people. Because what I believe is that if we start to manage people as outpatients and do a better job, then I think we have a chance to really change the trajectory of this thing, because it's looking like it's going to be a little bit out of control this summer.
Right. Yeah. And that is one of the things, right? We keep like the sort of benchmark for opening and closing is like ICU beds, right? And so if we were able to kind of decentralize some of that through clinics, you could kind of buffer some of the capacity for folks who are not, like you said earlier, waiting until they're just on their deathbed before they, decide to go seek care.
Right. Yeah.
Yeah.
This has been such a, oh, sorry, go please.
Oh,
yes.
But I'm not trying to really plug myself, but like these are things you can do. If people want to do a telemedicine appointment, we're helping people go through this, and the more people that we help, the more that we're learning. And I've figured out a ton just in this last couple weeks even. And so just from talking to people around the country that are going through it, and I've been on the phone almost every day till 10, just because there's been so much. But what I feel like is that something I still feel, and this is kind of like the PTSD thing, I feel like as a society, as a culture, we're going to take health more seriously. And on the other side of this, we're going to be better. And so.
Yeah.
Yeah. It's an opportunity for sure, if we can realize it in that way. And, I'm the consummate optimist. So I'm hoping that as a species, we really can turn the corner on this and find, some strategies for looking at these types of, scenarios long-term, because, viruses are going to happen as long as we're around and as long as we're not around. So it seems like we need to turn the corner on how we're approaching this as a human species, for sure. Yeah. Well, this has been absolutely fascinating. We thank you so much for your time. Again, there's like 50 other subjects we'd love to dive in with you. So maybe we can have you back on the show at a later date, but please tell folks where they can find you, or they can find out more about the clinics, the clinic and the therapies that we talked about today.
Oh, great. Yeah. You can come to bioreset.com. And then you can find out about us. And I have a podcast at BioReset Podcast. And it's just totally awesome to talk to you guys. And I wish you totally the best. And then come visit me on your way back down south.
Yeah, I know. I'm like, all right, I need some therapy. I'm sure I don't know which one, but I need something.
It's a smorgasbord.
Yeah.
That's awesome. Again, thanks
Thank
so much.
you so much for being here, Dr. Cook.
Thanks, guys. Have a great day.
And that's all she wrote, folks. I hope you guys dug that podcast. We certainly did.
Yes. And we are going to get down to see him and work with him a bit because I think that he's really on to some awesome stuff. So, here's the thing. The tide is changing in the world. We are seeing people, pioneers really, that are stepping up to the plate to kind of spearhead an effort towards changing the status quo. And I feel like Dr. Cook really falls into that.
Yeah. Yeah. He's definitely there. Yeah. And if you guys like this podcast or any of the other ones that we have done with awesome people, now is a great opportunity to leave us a 5-star review.
Yes. Share the episode, subscribe. We love hearing from you guys. We love seeing those 5-star reviews and all of the wonderful little special notes that you write to us. So thank you so much for everyone who's done that. And if you haven't done it, it's a great time to do it.
Yeah. No time like the present.
No time like the present. All right, guys.
Someday the internet might be gone. And then what? You'll have to send us a postcard.
Exactly. A love letter.
Yeah. And that's arguably more difficult. So just take advantage of the internet and just do it right now.
All right, guys. We'll see you next week. Thanks so much.
Bye.